Hi everyone, Rachelle here for Rona rounds number 8. This topic is, what will a COVID-19 patient look like? So earlier on, i.e. not presenting in cardiac arrest or severe respiratory failure, you are likely to see a patient having symptoms of fever, fatigue, dry cough, anorexia, myalgias, dyspnea, sputum production. These are all in decreasing order of likelihood. And then less likely symptoms are sore throat, headache, and rhinorrhea. In COVID-19 patients, they often have, or they will have, alveolar damage and an ARDS-like type of pathology happening in their lungs, and so often will present with hypoxia and are unlikely to have hypercapnia or hypotension. So paying attention to their saturation, their O2 saturation is very important. Treatments to consider and provide in a moderately sick presentation include providing oxygen at 1 to 4 liters per minute via nasal cannula as needed, and to start this once their saturations are hitting about 90%. Be aware of the potential for them needing oxygen once they're hitting 92%. And one other mode of safety is to have the patient themselves wear a surgical mask over top of their nasal cannula. We should be targeting saturations of 92 to 96% and trying not to go over and above this 96% because it can be associated with increased mortality in ICU. We can provide bronchodilators, but this would only be via MDI and not nebulizer because of the safety aspect that nebs, create aerosolized particles. There are no specific approved COVID-19 treatments in terms of antiviral therapy. There are antivirals that are being studied and looked at internationally, and these will most definitely be considered for us in Alberta as well, but usually ordered and provided by the ICU team and infectious diseases involvement. Empiric antibiotics and oseltamivir are something that are suggested in severe illness because it's hard to rule out a superimposed bacterial pneumonia in COVID-19 presentations. In terms of steroids, they're not currently indicated for COVID-19, but they could be considered as a treatment based off of the patient's comorbidities like asthma, COPD, or based off of severity of illness. In terms of NSAIDs, they aren't currently contraindicated. There has been talk about them related to a hypothesis that an enzyme increased by NSAIDs could worsen COVID-19 symptoms, and for that reason, they should be avoided, but there's not actually current scientific evidence for this right now. And so they're not contraindicated, but it doesn't hurt to try to substitute Tylenol or give that first. But any patient who is on NSAIDs on a regular basis for other reasons, there's no indication for them to stop taking them. And that's it for Rona Rounds 8. Thanks.